3. The purpose of this presentation is to provide an application of an empirically supported treatment to a client with post-traumatic stress disorder. Because I chose this approach with a current client, I must offer disclosure that I am a licensed master social worker operating as a therapist under the supervision of a clinically licensed social worker and a licensed professional counselor. I also must add that this presentation will not disclose any personal identifiable data of my client in order to protect her identity. All names have been changed and location of her is non-specific. Greetings, colleagues. This presentation is a demonstration of cognitive processing therapy in use with a real client under the disguise of a fictitious name in accordance with HIPAA regulations to shield her identity. Her name is Kimberly Ann. Who's Kimberly Ann? She is a 40-year-old Caucasian female. Kimberly resides in an underserved community in Georgia. She lived in a suburban neighborhood at the start of the sessions, but has since moved out until her own place, finally, with her children, to a less affluent neighborhood though. Kimberly is also a wife to her husband for the second time, who is retired military. She is a mother of 3 children, 2 teenage girls and a young boy. She has been a stay-at-home mother throughout the duration of their marriage, which has been over 11 years. Kimberly is also the daughter of 2 very supportive parents. They are the only outside support that she has, being that her husband has isolated her from having or forming any peer relationships. She has a high school level of education, yet Kimberly has always expressed that she desired more. So what does she feel? Well, Kimberly Ann presented with many emotions. She expressed first feeling lonely, like she was trapped. Kimberly also expressed feeling afraid of her husband and what will become of her life. She expressed feeling broken, and she also expressed feeling worthless. So, why is Kimberly in therapy? Well, on the self-report intake questionnaire, when asked why she was seeking therapy, Kimberly replied, "Finding who I am, become a healthy version of myself." Her reported presenting symptoms at that time were as follows: panic, anxiety, trouble concentrating, difficulty sleeping, excessive sleep, low motivation, fatigue and low energy, low self-esteem, depressed mood, tearful or crying spells, and hopelessness. Kimberly had a lot going on. Kimberly presented with a history of trauma. She had so many things to talk about, she didn't know where to start. They included domestic violence, sexual assault, life-threatening assault, drug addiction, alcohol addiction, the life of being a single mother, divorce, another impeding divorce, and a teenage daughter who is now pregnant. So what now? We must look at all of this, but first check out that index trauma. Of those revealed trauma experiences, her index trauma is the life-threatening assault, which occurred to Kimberly back in 2006. So, what happened? Well, in 2006, at the age of 24, Kimberly was physically assaulted by her then boyfriend in their apartment and left for dead on the kitchen floor. She ended up in the hospital with broken bones and a severe head injury that was causing her to bleed out. So you may be asking, what is the index trauma? Well, good question. I will gladly answer that for you. The index trauma serves as the basis for assessment of severity for PTSD. Kimberly experienced numerous forms of traumatic incidents in her childhood that she contributes to parental neglect. Then, at the age of 20, Kimberly experienced her first incidents of domestic violence. That was in 2002. After her index trauma in 2006, life continue to happen all around her and to her. Year after year after year, one bad thing after another, leading to drug and alcohol addiction to cope. CPT was the chosen approach because it showed the greatest reduction in negative trauma-related symptoms in comparison to other trauma-focused therapies. But study results indicate that trauma-focused therapies become less potent in reducing trauma-related beliefs as time progresses since trauma exposure, particularly in CPT for the beliefs about the world. Results indicate PTSD treatment should be provided in closer proximity to the trauma exposure before the negative trauma-related beliefs become inflexible. So this concludes that when the time between the index trauma and treatment is greater than 24 to 60 weeks, then there is less improvement in negative trauma-related beliefs and self-blame. So you might be asking, what is cognitive processing therapy now? Well, cognitive processing therapy is an evidence-based, trauma-focused form of cognitive behavioral therapy utilized with clients diagnosed with or presenting with many symptoms of post-traumatic stress disorder or PTSD, and has been demonstrated to be efficient across vast populations and settings. According to clinical practice guideline, CPT is one of the most effective forms of trauma-focused psychotherapy for PTSD. So, when it comes to the Christian worldview, though, studies have also identified that as negative post-trauma cognitions are associated with PTSD symptoms, negative religious responses to trauma may be predictive as well. Kimberly, my client, Kimberly identifies as a Christian, but Kimberly also admitted to struggling with her faith since the onset of increased symptoms and incidents of re-victimization. According to research, counseling from a Christian lens requires acknowledgement of client's ability, inability, or capacity to trust God. Kimberly believing that everything is her responsibility or her fault led to her believing that God felt she was deserving of it all. Scratch that out. All the abuse and the trauma, the cognitive distortions between self and God must also be addressed in order for the barriers between her and God to be confronted, so that she then may be able to confront the conflict within herself and start healing. So let's get started. First, we have the intake appointment. So this is the first appointment all the clients must do. And in that appointment, she completed her consent for treatment, client responsibility paperwork, company policy paperwork, so she was aware of everything that happens, release of information, permission to obtain information, consent for telehealth, because that is a necessity, because everything going on. We may need to do a video conference type style for her appointment. The biopsychosocial assessment was also completed, and the initial assessment for the PCL-5. All of these were completed within her first session so that we can prepare for what comes next. Her first session of cognitive processing therapy. In this session, we set the agenda, then we describe the symptoms of PTSD, the theory of why some people get stuck in recovery. Third, I described to her the cognitive theory, then describe the role of emotions in trauma recovery, briefly review the index trauma, describe the overall course of therapy, give her the first practice assignment, and then check Kimberly's reaction to the session. We did all of that in our first session together after the initial appointment. What comes next? Obviously, the second session for cognitive processing therapy. We first review the client's scores of the self-report objective measures. Then, have the client read the impact statement aloud and assist the client in identifying stuck points. Then, if the client did not complete impact statement, we address the non-adherence. Then we begin helping the client Identify and recognize connections between events, thoughts, emotions, differentiating the facts from the thoughts. Then we introduce the ABC worksheets, describe and discuss stuck points more fully, and give the new practice assignment and check the client's reaction once again to the session and the practice assignment. So colleagues, let's go ahead and move forward to session 3. Kimberly Ann with CPT. So let's show how this modality was implemented during this session. The main goals of session 3 are as follows. Identify the events. Yeah. Then identify the thoughts. Yeah. Then we move on to identifying the feelings. And we do all of this in order to determine how they are connected and to begin the process of discovering how they influence change between one another. This means that the therapist enhances the client's ability to identify and label emotions. Why? Because knowing the difference between natural emotions, those emotions such as fear, and other emotions that are autonomic, involuntary, or unconscious and manufactured emotions, those emotions are based on appraisal or conclusions such as the emotions of guilt and shame. So now we will look at the procedures for session 3. In session 3, we first will review Kimberly Ann's self-report scores. Then review the completed practice assignment. Next, the ABC worksheets. And Kimberly will learn how to label those thoughts. Fourth, we will use these ABC worksheets to challenge assimilated thoughts. Then give Kimberly the new practice assignment. Then we will check Kimberly's reaction to the session. Simple. So we begin. Let's review the handout. We will begin by reviewing the PCL-5 weekly assessment. First, number 1, repeated disturbing and unwanting memories of the stressful experience. That's a 4. Repeated disturbing dreams of the stressful experience. Suddenly feeling or acting as if the stressful experience were actually happening again. Feeling very upset when something reminded you of the stressful experience. Having strong physical reactions when something reminded you of the stressful experience. Avoiding memories, thoughts, or feelings related to the stressful experience. Avoiding external reminders of the stressful experience. Trouble remembering important parts of the stressful experience. Having strong negative beliefs about yourself, other people, or the world. Then blaming yourself or someone else for the stressful experience or what happened after it. Having strong negative feelings such as fear, horror, anger, guilt, or shame. Yep, that's a 4. Loss of interest in activities that you used to enjoy. Feeling distant or cut off from other people. Trouble experiencing positive feelings. Irritable behavior, anger outbursts, or acting aggressively. Taking too many risks or doing things that could cause you harm. Being super alert or watchful or on guard. Feeling jumpy or uneasy, startled. Having difficulty concentrating. And lastly, trouble falling or staying asleep. So we will move forward with reviewing her scores. The scores of the PCL-5. Re-experiencing are the score between the items 1 through 5 with a max score of 20. Avoidance are items 6 and 7 with a max score of 8. Negative alterations in cognition and mood, items 8 through 14 with a max score of 28. And lastly, hyperarousal would be items 15 through 20 with a max score of 24. Kimberly Ann scores. What do they say? Looking back at her answers, I was able to document her scores in each symptom category. Re-experiencing, 11. Avoidance, she got a 6. Negative alterations in cognition and mood, 16. Hyperarousal, a 5. Kimberly's total score for this assessment was a 38, which is seen on the sheet in her scoring, and 38 is the cutoff score for a provisional diagnosis of PTSD. Her score from her initial session, number 1, equaled a 24. So the first session was a 24. This fourth session, which is the third session using CPT, equaled a 38. This shows a major increase, which is shown and equals an elevation of 14. 14 is quite big. An increase of 4 in one, an increase of 5 in the next section, and in hyperarousal, an increase of 5 also. What does that look like on the score sheet, though? Well, with Kimberly Ann's score sheet, let's look at it. Scores demonstrate an extreme change in symptom presentation. As you can see, there it is, which provides tangible data that correlates with Kimberly having an elevation in symptoms following a recent victimization. Let's go ahead to the next step of reviewing that impact statement. The impact statement is utilized to compare pre- and post-treatment thinking. By having the client write the impact statement during the first session and again at the end to discuss future goals to mark the conclusion of therapy. The purpose of this assignment is for the client to compose a written description of how the trauma event has impacted one's perception of the world, one's own beliefs about oneself and others, trust, safety, esteem, intimacy, and power and control. Kimberly, on the other hand, did not complete it. Kimberly expressed a preference for verbally expressing the statement instead of writing it. So what do we do now? Well, we've got to move forward. But in vital component of treating CPT and treating clients who have these diagnoses is addressing the avoidant behavior. And according to studies, this is something that keeps them in that space of PTSD and doesn't allow them to move past the baseline, and they become stuck. So avoidant behaviors must be addressed. So we must address stuck points. We will go ahead and move forward with that. So in thinking about stuck points, a scripture came to mind. How long must I wrestle with my thoughts day after day and have sorrow in my heart? How long will my enemy triumph over me? Interesting. Well, these next examples are her thoughts. Why do I make stupid choices? Am I always controlled? Everything is my responsibility. The only control I had was my eating. I had nothing to control. Control is big for her, isn't it? I don't have time for myself. I cannot do what I want to do. Nothing is mine. I am not a good person. This is all my fault. So, where do we go to next? We go to reviewing the ABC worksheet. This was the assignment. So first, this is what that looks like. We're going to start with the date, 07/19/2022. That's the day of this appointment. And so we're going to start with column B. Why? Because we're working from the stuck point out. And her stuck point in this one is everything is my responsibility. And she also feels that I ask myself, when is it my turn? Or I have no privacy. What event activated this? Well, she said, when my kids are very needy and they need me to do everything for them all the time, even think for them. This showed frustration even in her body language during the session. And what did she feel? She said, I feel I have to constantly make them happy. She's referring to her kids. And I feel like I have no energy left. So I had to ask her, did you answer the questions at the bottom? The first one says, are my thoughts realistic? She said, well, no, because April, which is her daughter who's pregnant, should be responsible enough to set up her own pregnancy appointments and stuff for herself. I asked her why. And she wrote, because I'm not fully responsible for their happiness. I said, there it is. That's the answer. That's what you have to start telling yourself. So answer that next part. What can you tell yourself on such occasions in the future? I am not responsible for my kids' happiness because they are the only ones that can make themselves happy. And there it is. So I told her the rest of her stuck points, I'm going to let her take home and work on those. And this is what I gave her. Gave her a sheet, gave her a stuck point. I make bad choices. So I told her she's going to work on that one for sure because she keeps repeating it. The next one was, I am always controlled. Really, Kimberly? So next, Kimberly, we're going to work on, I don't have time for myself. We're going to learn how to do that. Next, nothing is mine. Her time is. But when she thinks about that, she said, not even my thoughts, my feelings, or my trauma. Nothing's hers. So that takes me over to going back to the identifying emotions worksheet so that she can accurately define her emotions in column C because those emotions weren't really defined. So we're going to revisit column C. I feel like what? Angry is what she said. And I'm ashamed. Angry and ashamed. So in reviewing that, I encourage Kimberly to utilize also the I think or the I believe in column B. And then reread that statement. So we're going to scratch that out and we're going to read it the correct way. I believe everything is my responsibility. So use of the ABC worksheet is now going to be utilized to begin challenging those assimilated cognition. Okay? So Kimberly started with the issue of being responsible for her daughters. And what did that uncover? Kimberly understanding what? That she feels responsible for repeatedly being victimized because she feels like it's her fault. Now, it's time for the Socratic questions. So what do we say here? When reviewing the worksheet, you said that you were angry and ashamed. So who were you angry with? And what were you ashamed of? Kimberly responded to me, angry and ashamed of myself. So then I asked, can you help me understand how you being re-victimized is shameful for you? Kimberly responded, if I didn't make stupid choices, none of this would have ever happened to me. Another stuck point still needing to be addressed. She identified it. Next question, what choice did you make? Kimberly sighed and she said, stupid ones, like I always make. I was drinking. I was drunk. Whoa, Kimberly. Whoa. Socratic questions and responses is something that we continued. I continued to do, and as they were demonstrated throughout the teachings, so that Kimberly can learn. Kimberly continued with this back and forward. We just continued this until she was able to get her emotions out and rationalize her thinking. Kimberly was able to trace all of those current thoughts and emotions back to that index trauma. Never addressing the image trauma is what led to the re-victimization throughout her life. So I provided her with those assignments to take home. I put them in her hand and told her, this is what you're going to do with every one of those. So last but not least, what do we have? What is Kimberly thinking at this moment? So I asked her, Do you have any questions, Kimberly, about the session or about the new assignments that I gave you to take home? She sat and she thought and she thought. All she could say was, I don't know how I'm going to do this. How am I going to do this? She said, I don't have any questions for you, but I keep asking myself how I'm going to do this because it's hard. Because she held on to the traumas for so long that she did not know how she was going to conquer answering all those questions about those stuck points and getting them out of her head. And that was the end of session 3. But since session 3, Kimberly has been compliant in moving forward with the CBT sessions, and we are now in session 7. And there is so much documented information that I have on her showing great improvement. Thank you.